Good evening, welcome to Monday's Midlands Today from the BBC. Tonight, a warning of a growing care crisis as charities are concerned that unpaid carers are putting their own health at risk to look after their loved ones.
Well, in a survey to mark the start of Carers Week, Carers UK found that nearly half of all carers put off having medical treatment because they have to look after a family member. Now, here in the Midlands, there are nearly 600,000 carers, and it's estimated they save the country just over £11 billion a year. But nearly 80% of carers in this region said caring had a negative impact on their physical health. Carers UK says there needs to be more financial and practical support. But with budgets being cut, carers are finding out what support is available is being reduced, as Bob Hockenhull has been finding out.
Single mother Jane Thomas from Yardley Wood in Birmingham is one of 6 million unpaid carers in the UK. She has 2 autistic children who need constant attention. 8-year-old son Daniel only needs 3 hours sleep. He attends a residential school 3 days a week because of his condition. The rest of the time he's looked after at home.
It is tough because you never know what each day is going to bring. It's like a roller coaster having a child with autism. You know from the minute you get up if it's going to be a good day or a bad day.
Daniel and his mother attend a carers group which provides support for 50 families at Dal Meadow Community Centre at Druids Heath.
Dal Meadow is a lifeline, not only for the children but also for the parents and the carers. Dal Meadow provides my son with a stable social group, which is what his condition doesn't allow him to have.
But the funding for the centre is about to run out. Grants from the South Birmingham Primary Care Trust have been axed and the building is threatened with closure next month.
And how would you feel if suddenly it wasn't here and you weren't able to come?
I would feel angry and sad because this building's helping me out.
As well as giving advice and practical support, the group organises social events for mothers and their children.
I've been coming to this group for over 12 months and it's given me a level of independence and it stopped me from being isolated.
The threat to Dal Meadow coincides with research suggesting the strain of coping in an age of cutbacks is proving difficult for many. In a survey of 3,400 carers commissioned for Carers Week, 87% said the stress of looking after a loved one was having a negative impact on their mental health, and 83% said their physical health was suffering as a result of their workload. Daniel's mum says she recognises times are tough, but feels carers shouldn't have to bear the brunt of cutbacks. Bob Hockenhull, BBC Midlands Today, Birmingham.
Earlier today I spoke to the Labour MP for Telford, David Wright. Did he feel there was a crisis looming and were carers getting the support they needed?
Well, Carers UK have indicated that about 80% of carers don't actually realise or didn't realise they were going to end up as carers, and about 20% of carers have already commented or have seen the impact of government cuts to date. So I do think we need to keep a focus on carers when we look at how we deliver services. And as I've said, we have an excellent carers contact centre in Telford. I think that's the way to go forward, Nick, because it gives a connection between council services, health services and the voluntary sector. That's really crucial as we move forward.
And you talk about cuts there, but the Department of Health say that £400 million, I think it is, of additional NHS funding has been allocated until 2015 to pay for carers' breaks. Isn't that a positive step?
Well, it is good. I think carers do need breaks and need respite themselves. But I think the real impact comes in terms of local authority services, where local authorities are providing support services to carers. And obviously, as budgets get tighter and tighter, very often some of the services that carers enjoy fall off the edge. So I think we've got to look very closely at how local authorities are handling these matters. I think the government is going to have to look again at local council budget issues as they relate to carers. You know, it is important that we build partnerships, that we include voluntary organisations, but it's crucial also that we understand that local authorities provide a lot of background and direct services that support carers.
Do you see it as a political issue at all?
Well, look, I think it's a cross-party issue in many senses. I think we can celebrate the work that carers do. You know, they look after people in society, and as I've said, people often don't realise that they're going to become carers. It's an issue that can affect us all over our lifetimes, we need to make sure we're supporting those that care for people in our community. They do an incredible job for all of us, and we need to give them what support we can.
David Wright, thank you.
Coming up